Good evening, one and all. As we are heading up to Patient Safety Week on September 17th, in order to bring awareness, we NRI has prepared a poster presentation. Patient safety, the most important aspect to adhere in all healthcare setup in order to prevent adverse or unnecessary events. In order to prevent adverse or unnecessary events, Joint Commission International in 2006 has laid 6 international patient safety goals. Identify patient correctly, improve effective communication, improve the safety of high alert medications, ensure correct site, correct patient, correct procedure, reduce the risk of healthcare associated infections, and reduce the risk of patient harm resulting from falls.
Can you imagine yourself without a name or with a different name? No one can imagine without a name or identity. How do we identify a patient? By using two different identifiers, patient full name with the medical record number and date of birth. Where we can find patient identifiers, patient ID bank and patient medical record.
When do we use two patient identifiers? Before medication administrations, before administration of blood and blood products, before taking blood samples, before endorsing of baby for breastfeeding.
Hi Mrs. Sunita, how are you? I'm Rajesh, I'm your nurse. I'm giving you some medications to relieve your fever. Injection name paracetamol. Before giving injection, I will confirm your identity. Please show your identity. Okay, Miss Sunita. ID number 201964. Okay, thank you. As soon as I go, I'm giving you injection. It will give you some pain. Please call her. Thank you, Senator.
In order to improve effective communication, the message should be accurate, complete, clear and timely manner.
In order to improve effective communication, SBAR should be followed in all healthcare setup. S for situation, B for background, A for assessment, R for recommendation or request.
However, we follow standards to improve effective communications. There will be most error-prone communication while receiving verbal telephone orders and critical value results.
Hello.
Good afternoon, Dr. Supraja.
Good afternoon, Dr.
This is Brother Sudhir calling from second floor cash rooms regarding your client Mr. Andrews Cooper.
Okay.
Mr. Andrews Cooper had one spike of temperature 101.1 degree Fahrenheit. Is a diagnosed case of carcinoma tongue, operated second post-op day, left hemiglossectomy. Actually, patient is not having any comorbidities. Right now, Mr. Andrews' pulse rate is 99 beats per minute, respiratory rate 24 per minute, blood pressure is 138 by 76 or mm of Hg. Saturations 99% on room air.
Okay.
Dr. Supraja, would you like to suggest me any medications regarding hiking?
Okay, Brother Sudhir, please give injection paracetamol, IV stat.
Dr. Supraja, you have ordered Paracetamol, paracetamol, 1 gram IV
Yes,
stat. Thank you, Dr. Supraja. I will carry out your verbal order. And once when you are for a patient visit, please document your verbal order.
Okay, Brother Sudhir. I'll document my verbal order once I visit the patient. Thank you.
Thank you, Dr. Supraja. Have a nice day. Are we allowed to take verbal orders? Verbal orders should be restricted only in emergency or life-threatening situations. But when you receive the prescribing order, should spell out medication order, dose, and state the purpose of order, date and time of the administration. While receiving, the nurse documents in the nurse's notes and read back the verbal order and wait for the confirmation from the doctor. This year's theme for patient safety is safe maternal and newborn care. As we do not have the scope of service of maternal and newborn care, so we are treating our patients like it said. Last but not the least, patient safety is in the hands of every healthcare personnel in the hospital.